Hey, it's Dr. Matt here. I hope things are going well out there. I wanted to talk a bit today about disc bulge, disc herniation, and some of the things you can actually do on your own to change some function, but also to get some pain relief. So here's a couple of ideas. I want to explain first the anatomy and how things work a little bit. So if you have a look on the spine here, you'll notice there's actually a disc bulge portrayed here on the model, but you have your nerve system, so you have your brain up here, brain's extension cord, your spinal cord sends messages all the way down. Those nerves have to control your body. So those nerves are going to go to your muscles, but also your organs. So what we're looking for, a lot of times people have disc bulge or herniation, they may have localized back pain, but they also may have leg pain, and that's when it can become a bigger challenge in terms of quality of life and how you move. So if you have a look, a lot of the time the whole idea of a disc bulge or herniation is a result of bad mechanics where things don't move the way they should. So one area will take a lot of stress, and that impact absorber, the motion between the segments, gets distorted, and all of a sudden the pressure pushes material out. So if you don't move above and below that well, you're going to compensate in the middle. And what I mean by that is you'll see here this L3, L4 disc herniation here. The person had bad movement through here, lack of motion, things didn't work so well, and finally the body had enough and it pushed out some material. So the big important thing to remember is a lot of things are modifiable, and that's the really neat thing, and your health is essentially in your hands. So I'm going to show you on the diagram next what to look for. And remember, it's uncomfortable, right? So people who come in typically have leg pain, numbness, tingling possibly, and even the big thing to look out for, which may be more of an emergency, is problems using the washroom, because those nerves are going to control your whole body, right? So if you have a look here on the diagram, you'll notice the vertebrae here, the spinal cord coming down, and there's different types of disc material, essentially the jelly in the middle, pushing out, right? So it can push out on the spinal cord, it can push out on the lateral nerve root, which goes more to your organs and down to your muscles, and then as well it can push even further out through here. And a lot of the time I'll share with people that if they've had a full blowout, it's often, not always, but often advantageous, because your body is smart and will go and eat up all that material. So if it's completely blown out, recovery can be different versus if it just bulges. And if it just bulges, you won't see this here. So it'll be closed off. It'll just be pushing. And it may be pushing on the side nerve root, or it may be pushing centrally on the actual spinal cord. So a lot of neat things in terms of making this modifiable for yourself. Some things you can do on your own I want to share today, and then the role that a neurostructural chiropractor can play in your overall health as well. So if you have a look, a lot of the time that material, remember, is shooting back. So it's pushing, this is your buttocks by the way, it's pushing this way. So the neat thing is that when you flex, a lot of the time the material pushes back and makes symptoms worse or changes things altogether, right? So what I would suggest, something you can try on your own, and I'll get Grace just to show you from the side. Grace, if you come stand over here. On something, a hard surface or a bench or a table, a lot of the time putting yourself through a range of motion will help too for some relief. So if you're like this, extend your spine and flex right up. So this is called the cat camel. And you come right down and then flex right up. And a lot of the time this extension position through here can provide some relief. With that one I would do anywhere from 6 to 10 passes, and just whenever you want some sort of change in function or some pain relief, give it a try, okay? The other thing I want to show you is you got to get down on the ground for this one. And this one's neat in the sense that if this bothers you bending forward, you want to do the opposite. So doing the opposite actually means finding a way to get in that opposite position. And how I would do that is you can, if you're hanging out at night or when you're relaxing, spend more time on your stomach. And so what I would do is actually hang out like this in this position and see if that gives you any relief. And a little tweak to that is just shift your legs off to the side. So if it's more of a right-sided bulge or herniation, you may find that bringing your legs off to the one side helps more than just having them centered. And you can hang out more in that position and see if it gives you some relief. The other exercise you may want to try is when you're down like this, just come into the push-up position and just gently bring yourself up and breathe from your stomach. But just hang out there. And you may find relief with that position as well. And remember, what you're trying to do, the thought is that you're actually helping to pull some of that material back and decrease some of the symptoms. So at the end of the day, give those 3 a try. And don't forget, if you're compensating, because a lot of the time, that's like the breaking point where the disc herniation or the bulge is. It took all the stress and it said it had enough, and finally it pushed out the jelly material, and here you have a lateral bulge or herniation if it's actually going all the way out, right? So a lot of the time, if you're compensating above and below, and even if the mechanics of your neck don't move so well, that's one thing that a neurostructural chiropractor can actually help with and improve. Mechanics all through here, and also nerve supply so that your brain's more aware and to help you heal better. So consider those factors next time you're thinking disc herniation or disc bulge, and try those for some relief. And also consider getting checked, because some of the areas you're going to feel, but many more of the areas you're not going to feel, and the only way to actually tell is to actually be checked by a neurostructural chiropractor. So have yourselves a great day, and I'll talk to you very soon.